Hi, my name is Justin Fox, and today I'll be presenting a PSA on hemophilia A. Hemophilia is a bleeding disorder that slows the blood clotting process. People with this condition experience prolonged bleeding or oozing following an injury, surgery, or even having a tooth pulled. In severe cases of hemophilia, continued bleeding occurs after minor trauma or even if there is no obvious injury, sometimes called spontaneous bleeding. Serious effects can result from bleeding to the joints, muscles, brain, or other internal organs. Milder forms of hemophilia do not necessarily involve spontaneous bleeding, and the condition may not come apparent until abnormal bleeding occurs following surgery or a serious injury. There are three types of hemophilia: hemophilia A, B, and C. Mode of transmission. Hemophilia is a genetic disease which is shown in an X-linked recessive pattern, being most common in males. 1 in 4,000 to 1 in 5,000 males worldwide are born with this disorder. Females only have a 0.5 to 1% chance of actually showing signs of hemophilia, but will carry it on their X chromosome. Hemophilia almost always occurs in males who only have one X chromosome. Females who inherit an affected X chromosome are often protected by their normal gene on an X chromosome. Morbidity rates. For most of human history, hemophilia was regarded as a fatal disease. In the 1960s, most people born with severe or moderate hemophilia did not live until adulthood. In more recent times, an experiment ran from 2000 to 2021. The mortality rate amongst a study group of people with mild or moderate hemophilia was 27 deaths per 10,000 person population, with a 95% confidence interval of 18.4 to 41.6. Making the mortality rate 0.277%. Although towards the end of the experiment was the heightened point of COVID-19, some of the results recorded might have been affected as a result of the pandemic. In a different graph shows a mild to moderate hemophilia does not have a significant effect on life expectancy. Only severe cases of hemophilia will shorten life expectancy by only about 10 years. Region of origin. Hemophilia A is caused by mutations in the F8 gene. The F8 gene encodes clotting factor 8. This mutation is passed down through one's family and cannot be contagious. In some cases, hemophilia arises from a spontaneous mutation in the F8 or F9 gene, occurring in a family with no prior history of the disorder. Signs and symptoms. Signs and symptoms of hemophilia begin to show usually from about a newborn to the age of 11. Signs of hemophilia include nosebleeds, bleeding in mouth or gums, swollen or stiff joints, bruises that don't heal after a long period of time, coughing up vomit or blood in urine, and heavy menstrual bleeding. Diagnosis and prognosis. To diagnose hemophilia A, the doctor makes a diagnosis by measuring the level of factor VIII activity in a sample of your blood. If there is family history of hemophilia or a mother is a known carrier, diagnostic tests can be done during pregnancy. This is called a prenatal diagnosis. Some other ways to diagnose hemophilia are done through tests such as linkage analysis, methylation analysis, mutation scanning of select exons, sequence analysis of select exons, target variant analysis, deletion duplication analysis, and sequence analysis of the entire coding region. Treatment and care. Effects of hemophilia can only be reduced with constant treatment due to your body making new blood cells at all time, but it can be treated by using options such as prophylactic treatment, which involves regular administration of clotting factor concentrates to prevent bleeding episodes and joint damage, antifibrolytic medicines, which are drugs that help prevent clots from breaking down, desmopressin, which is a synthetic hormone used to treat mild hemophilia A, and it stimulates the release of stored factor VIII from blood vessel lining. Finally, replacement therapy, which provides factor VIII concentrates to the body donated from human blood or produced using recombinant DNA technology. Here are my sources, and thank you for watching.